There's hope and help for people who suffer from continuous back and leg pain. The first lumbar total joint replacement in the U.S. was performed here in Chattanooga.
Latrice Curry has the story in Eye on Health.
More than half of Americans say they are living with chronic pain. The biggest culprit is back pain. Up until now, a spinal fusion was the main surgical treatment.
The biggest downside to fusion is that the next level frequently goes bad relatively quickly because we know that we're stiffening the segment below, and so it's putting more stress on the next level. And so everyone kind of knows someone that's had multiple back surgeries where kind of one leads to another, leads to another.
Dr. Benjamin Geddes is a spine surgeon with the Center for Sports Medicine and Orthopedics, where he completed the first lumbar total joint replacement in the United States.
It's a through the back surgery where you can go and you take both of the joints off and can do all the work you need to do by cleaning up around the nerves, because a lot of these folks have pinched nerve issues. And then you put these little prostheses in like you would in like a hip or a knee replacement, and they move and behave in a way that the normal spine would.
Dr. Geddes says this does the same thing a fusion would, but you do not have to make the patient stiff.
It allows for us to restore the normal motion of the back. And that's been a big issue with spine surgery. We can do a lot of things we need to do, free up the nerves and make leg pain better and stabilize the spine if there's a little bit of instability from, arthritis. But in order to achieve that, we've had to sacrifice motion and being able to move normally.
Dr. Geddes says the goal is always to help patients return to the activity level they once enjoyed. And this technology gives them another option to help them do that.
But you're still going to have some of the normal wear and tear at the other levels of your spine, and certainly could have an issue. But we know that the rate is much higher after a fusion.
Our thanks to Latrice Curry for that story. And as for recovery, the first 6 weeks are similar to fusion with some restrictions on motion and lifting. Patients normally notice the biggest difference by about week 8. Then they can return to their previous activity level.